All right, welcome aboard, ladies and gentlemen. Thanks for those of you who have joined us for a little bit of crosstalk here beforehand, and thanks to those of you who are joining us here now. My name is not Action L&D. My name is Randy Lober, Learning Development Specialist here at Action Benefits. Happy to welcome you to today's session, 4 Reasons Medicare Consumers Flock to UHC, featuring David Blackburn and Robert Hamlin, both here at Action Benefits, and both broker sales managers here at Action as well. Turn it over to them in just a moment. But we want to let you know, I guess, what we're going to be doing here today and give you a little bit of context, what we mean in some of our messaging. Why do 1 in 3 consumers choose UHC? We're going to spend some time digging into those reasons. We're going to spend some time looking at co-branded plans that give consumers the AARP value. We'll take a look at their unrivaled flexibility in the MAPD market. We'll look at their Medigaps and PDP options. We'll look at what their D-SNPs have for some of your most vulnerable consumers. And we'll look at some incentives that boost both your pleasure, there's some travel there, as well as your profits, both some incentives that UHC puts on and that we offer you here as well, especially in the Medicare supplement market. So if you're ready to learn why 33% of Medicare supplement enrollees choose UHC and 28% of Medicare Advantage enrollees across the nation choose UHC, David Blackburn is going to tell you all about it, starting with AARP.
Thanks, Randy, and thanks everybody for joining us this morning. It's nice to see some familiar names in the participants list. I'm going to give you a good little run through here. This is not a product training. We're not diving into the details. Wanted to just spotlight some of the things that we think make UHC stand out. We're really excited to be partnering with UHC and offering these plans. Been really thrilled to get on board and running with them. And, you know, there is a reason that they are America's largest health insurer. And to Randy's point, have that kind of market share. So we'll give you some highlights, some things that I think are sales differentiators for them. Robert, please feel free to chime in with some color commentary here and there. You know these plans as well or better than I do.
It's hard for you guys to keep me quiet. So yeah, I'll jump in.
So we'll go through all of that and we'll give you some good thoughts on why you should be working with UHC if you're not already. Again, 33%, 1 in 3 folks have that are eligible for Medicare have a UHC Med Sup plan. 28% have an AARP Med Advantage plan. You know, those are nationwide numbers, but that is massive market share. And I think a big part of that is attributable to 2 things. First, the AARP co-branding. You know, that can't be overstated, the value that brings to these plans and the credibility it lends to them. The other thing is that you may have noticed with the new CMS marketing rules, Jimmy J.J. Walker and Joe Namath are showing up on the TV a lot less. But if there's somebody that has not reduced their marketing spend recently, it's definitely UnitedHealthcare. I feel like anytime I turn on the TV, I'm seeing their commercials, and they're very well done. They have a great name recognition in the market at this point, definitely, and consumers are comfortable with them. So that goes a long way. But as we think about that co-branding, you know, AARP, great organization, nonpartisan. I know some folks have their feelings about the AARP and think that they're, you know, some far left or far right advocacy group. I've heard it both ways. Reality is they are a senior focused advocacy organization, totally nonpartisan. They work on behalf of folks in that senior market, looking at ways they can benefit their lives and improve things. So in addition to advocacy and you know, lobbying and all of those things, they also have a great relationship with UHC and help influence the benefits that you'll find in their plans. They're able to poll their members and drive real consumer feedback to the carrier in a way that a lot of carriers don't have kind of that same opportunity. They also give AARP members exceptional educational resources, lots of great expertise available in a variety of different formats, whether it's live events, the website, webinars, all sorts of great literature on everything from healthcare and health through Social Security, finance, so many other topics. So membership, which is a requirement to enroll in an AARP co-branded plan, you've got to be an AARP member, but you get a lot more for your membership than just the name recognition. Of course, they've also got, community and social programs. They have lots of great resources for caregivers. I know, having been through some of that myself over the last few years, there was a lot of value in things that I was able to get through UHC to help me kind of manage my own stress levels and my own challenges in that caregiver space. And of course, if all of that isn't enough to move the needle for you on AARP co-branding, the discount and reward opportunities that membership get you are just phenomenal. And they're all the way up from buying new and used cars and, automotive repairs and car insurance and those kind of things, on through entertainment, dining, travel, lots and lots of stuff focused on health and wellness. Fantastic discounts for technology and home essentials and all of those things. So,
Hey, Dave, I'm in my first year of being a member of AARP. Okay. My kids are graduating from college, so you guys know, but I did a quick outline, just a real brief outline of the true value and the savings that people can get. And here's just a couple. You save $10 per line per month. As an AAR member, you can save $120 per year. Hotels and resorts, you save up to 20%. So that's about $175 per year that you can save. You talked about the auto buying program from TrueCar. You can save about $100 on that. Airfare, you can save up to $200 per person. $400 if you have a partner. So you got another $400 in savings there. Car rentals, 30%, about $105 per year. So just those alone is over $700 in savings for a $12 annual membership. Phenomenal value there. Phenomenal.
Yeah, hard to beat that for $12. And I'd encourage all of you on this call today, hop out to aarp.org. It's .org. They are an organization, and check it out, because there is a ton of stuff, and we tried to give you just a few highlights, but lots and lots of good value. Now, diving into the plans themselves, let's start in the Advantage realm. I know that's where a lot of folks are focused these days. And like every competitor in the space, for the most part, Advantage is driven around those $0 premium plans these days that have become so popular. And AARP, UnitedHealthcare, doesn't disappoint here. They've got some great options with the zero premium. Even their option 2 here that has a $28 premium brings some great value for that price point. But what you'll see throughout their menu, and again, not highlighting the whole thing, we're looking at their PPO options here. $0 deductibles, $0 copays for primary care visits, really reasonable specialist visit copays, somewhere in the $30 range. Inpatient hospital copays, they're generally low, $325 is the maximum. And if that's a concern for you, there are lots of great ways to supplant that with a hospital indemnity plan, whether it's the carriers we work with. We've got great relationships with GTL and Wellaby. They offer some fantastic coverage in that space. Or if you've got another partner you like, it's a great way to cross-sell, increase your commissions, and really deliver a fantastic level of coverage for your clients. Of course, your out-of-pocket maximums on these plans, fairly low as the market's concerned. I'd say they're very competitive. And, I think one thing that really stands out to me is the $0 copay for generic RX, or preferred generic, I should say. So if you've got folks taking really common drugs, it's a great way to get them in their hands nice and cheaply. But the big standout for this that I think makes really all the difference in the world for a Medicare Advantage PPO option is that this is a truly open PPO. It does not have a network. It's accepted by any doctor that'll take Medicare. So if you've got clients that snowbird for long periods of time, somewhere a little off the beaten path, maybe it's not Florida or Arizona, maybe they're in California or South Carolina or somewhere else that some of the local competitors don't treat with the same open access. This is a great way to make sure they've got full coverage wherever they want to travel year round, anywhere they go. And even locally, we all know there's always a network challenge. You can run into somebody that's got a real need to see a specific specialist or something, and really struggle with it. Even in UHC's non-open options, their network strength is unbelievably good. But these open PPOs, they're a great way to go because they really have no restrictions. You have very little concern about doctor access, and it'll save you time in the sales cycle too. So that, I think, is really the driver for the PPO, in my opinion. Of course, if you've been around a while, you know AARP, UnitedHealthcare, known for their med sup products, and there's a good reason for it. Actually, lots of them. They're really competitively priced. They offer a great full menu. They have unrivaled member satisfaction scores on these plans, and they're not your basic stripped down med sup plan. Now, UHC does offer in some other states, not yet in Michigan, but they have a plan called UHICA that really strips out a lot of the value add benefits that you see on the screen here. Not here in Michigan, but if you're selling in Ohio or Indiana, I'd love to talk to you about it because it's a great plan and it's a really good price point, brings some significant discount to the party. But here in Michigan, what you see in their subs is that they do have a lot of value add. There's great opportunities for gym memberships with a huge network of gyms and fitness locations, access to thousands and thousands of on-demand workout videos and live streaming fitness classes, social activities and wellness classes. There's an online Fitbit community that's pretty cool. I know Fitbits, you don't hear about them quite as much, but lots of folks are still using them and counting their steps. And it's good to have a community of folks behind you to kind of keep you motivated and help you stay accountable to yourself. And of course, you see some great discounts in here when you look at dental services through Dentegra, vision discounts through iMed, hearing, $100 off the AARP member rate for name brand hearing aids. That's huge. Hearing aids have become so expensive for the good stuff. It's always a concern for folks that have any kind of an issue there. So AARP brings a lot to the party in that sense. And you've also got, benefits like the 24-hour nurse line, which is a great convenience if you've got anything going on in the middle of the night and you just need a quick consult with somebody to say, take a Motrin or head to the emergency room, somewhere in there. I know personally I've used the nurse line on coverage that I have a couple of times, just needing a little advice from regarding my kids, and it's been great. But again, lots of cool value adds there and a full menu of med sup plans that have a tremendous name recognition and a great level of consumer trust.
You know what else is great about their med sups is their rate stability. You look over this over a long course of time, and they've been able to hold their rate increases to a very minimal amount. So great opportunity for those that love the med sup market to get them into a product that's going to be stable and they're able to have for quite a while.
Yeah, absolutely. Of course, if we're talking med sup, we got to talk PDP too. And I think this is somewhere that, again, UHC shines in my eyes. I think what I really love about UHC's PDPs is that they strike a great balance between premium and formulary. And for those of you, I know I saw some familiar names on the list today. Those of you who know me know I've been at Action coming up on 13 years. And so I've pretty much bled blue for most of my career here. But when it came time for my mom to make the transition into Medicare quite a few years ago now, we put her on a Blue Cross Med Sup, a legacy option. It was a great option at the time. We started looking at PDPs and, she was on a lot of maintenance drugs for a number of chronic conditions. And frankly, there was no way to beat UHC's price point or their access. Right now, I think the average nationwide premium for a UHC PDP is somewhere in the $32 range, which is, really, really minimal. And their formulary is extensive. They give you great access to drugs. They also have fantastic access to pharmacies. Their preferred pharmacies include Kroger, Sam's, Walmart, and Walgreens. Standard pharmacies are Rite Aid, CVS, Meijer, Costco. Pretty much anywhere you got access to drugs, you got access to your coverage. And here in Michigan, those preferred pharmacies are everywhere. If you think about, Kroger, Sam's, Walmart, Walgreens, I can't go anywhere without finding a Walmart or a Walgreens, and Kroger, of course. So I think this is really a differentiator. So many of the competitors in this market have really kind of taken their focus off standalone PDPs as they've tried to steer membership towards Advantage plans. You see that the standalone PDPs don't have the formulary, or they may have more premium than they used to. UHC hasn't taken that approach. And they also haven't taken the approach of some of the other national players, which really drastically reduce rates at the sacrifice of pharmacy benefit and commissions for that matter. I think some of you probably know who I'm talking about in saying that. They've been really stable in this market for a long time. And there's a lot to be said for that. And if you're selling this up anyway, consumers love to bundle things together with the same carrier. It makes it nice and easy for them.
Yeah, I just real briefly challenge people to look up people's drugs and use UnitedHealthcare. Great formulary. Those people that are on the little more expensive drugs, you're going to find a good savings with UnitedHealthcare.
Yeah, absolutely. Of course, there's one more market that we always talk about in this space specific to UHC, and that's D-SNP. I know it's not something everybody's selling, but it's a great market if you've got if you run into those clients that fit it. And there is nobody in the market better than UHC for D-SNP plans, honestly. They offer PPOs and HMO POSs. See that the benefits we've got listed here look pretty similar, other than the the OTC cards and that sort of stuff. The PPO being a little lower at 155. But I think what stands out there is the fact that you can actually use those OTC benefits as a member towards utilities, even down to things like home internet. So they really try to drive value in their plans here. D-SNPs, of course, offer unbelievably rich coverage from a medical perspective and lots of value-added benefits. They're great. But I think that utility benefit is kind of the standalone, set them apart, make them look a little bit unique in the market aspect of these. And again, here's the HMO POS. As I said, that one's 180 for the OTC, but you're still looking zero premiums, $0 medical copays, so on and so forth.
And for those agents that might branch out of Michigan, two things to keep in mind. One is sometimes the OTC can be as high as $225 a month in other states. But what's really important though is you got to check doctors. Not every doctor participates in every D-SNP. It happened to me once. They had a doctor, I thought I placed them into $180 per month. I'm like, oh no, I got one here that has $225 per month. Found out their doctor doesn't actually participate in that particular plan. I don't know the reason. Maybe it's the HMO versus the HMO POS, but very important to check out and verify their doctors. But I'm just going to say it. I think UnitedHealthcare, when it comes to D-SNPs, are maybe some of the strongest ever in the nation.
Yeah, I would agree with that completely from what I've seen. So again, this is a market that some agents really find a niche in and others don't. But if you're looking at dual options, I think you have to think UHC. There are a few other players in this market, but I don't know that you'll find anybody with as rich and accessible a benefit. And stability for that matter is always great there too. One of the things I hear from agents about D-SNP is that members tend to be pretty upwardly mobile with their plans and may jump from one to another. I think UHC's benefits are good and the plans are robust enough that it does discourage some of that to an extent. So great option to look at if you're in that market. Of course, all of this that we've talked about means nothing to you if it's hard to sell and hard to quote and hard to enroll in. And that's another place I think UHC is really strong. And I'm going to hand off to Randy here for a minute to talk about the agent tools, because I think they really have done a nice job and he's got a good level of familiarity with them. So with that.
Yeah, thanks, Dave. And thanks, Robert, for sharing your knowledge here so far. I want to talk briefly with you about agent tools and what UHC has to offer here. This is not going to be a full-on demonstration of Jarvis because as you can see on the screen, there's a lot here to know, like, and love. We want to give you a sense of just how much information UHC puts at your fingertips when you get appointed. So if you want to look at your home screen here, there's no real tooling around in a lot of these menus. Yeah, you can find the resources up here, but for anything you want to sell, everything you need is right here at your fingertips. You can find plans, so you can start the quoting process here right away and start enrolling depending on where your clients live. If you want to check applications, you're able to do that here as well. Well, what's really powerful is right up here up front is they do have a built-in eligibility checker. So if you want to see if your client has an MBI or when their Part A and B are effective to see if they're even eligible to talk to an Advantage plan yet, or when they might be eligible, you can do that. You can also look at their LIS status all right here, right? So you can see, are they LIS 1, 2, or 3? How is that going to impact their copays on a D-SNP when they're going to get a prescription filled? We'll talk about the Lean tool here in a minute. That's their enrollment platform they use for both their Med Subs and their Medicare Advantage plans. They have access to probably the most robust, and this hurts my heart here in action, but the most robust learning library I've ever seen, full of materials for you. That's where you get all your certifications done. It's where they'll tell you all about how to use all their agent tools. Lots of good things for you to know in there as well. You'll also see prescription drugs, pharmacy. You can look up all kinds of providers, all different kinds of ways here, depending on specific products you're interested in here, even down to chiropractic and acupuncture, right, for those limited amount of Medicare visits that your folks will have covered each year, as well as for your Med Sup folks, right? They have that Renew Active Fitness locator. So you can, right here at your fingertips, find the gyms that your folks might want to be interested in and be able to apply their discounts at. So everything you need here, as soon as you log in, just within a click or so, gets you to the tool you want to be in. As far as carrier portals go, I've had my fair exposure to a few of them. This one does make finding what you need relatively simple. Also grabbed a quick screenshot from Lean here just to show you what's available to you inside it. And it's great resources if the only thing you want to present to your clients is a UnitedHealthcare plan. You do have the opportunity for your Med Advantage and Part D plans to complete your scope of employment right here in the tool, as well as collect voice signatures. So your clients can say, yes, please enroll me in that plan if they so choose. You'll see applications and ways to get back to there as well. You also see companion sales. So what else are you going to sell with that Medicaid supplement? That opens up opportunities for you to also link into PDPs and some other products that UHC offers there as well as a variety of links. Really, really friendly tool to use, especially if all you're concerned about is quoting and enrolling for UHC and UHC products, whether they're sub, whether they're PDPs, whether they're Advantage. And knowing a lot of the names in the room, maybe you want to see a few more options for your folks. Maybe you do want to present a few different carriers. Coverage for One, powered by Sunfire, is one way that we provide our agent partners to do that. So a quick screenshot here, full disclosure, giving a full demo tomorrow morning at 10 o'clock. It's you'll see our training calendar pop up on your screen in just a moment, if what I'm about to say makes you curious at all. But here's some things that Coverage for One does and lets you see as you're helping your clients make a decision that works for them. You can input their current coverage, look at preferred pharmacies or the current pharmacy, input their medications, any preferred doctors, and how often they use care. And what Sunfire does is spit out a score based on all the doctors, how they're covered, whether they participate, what their anticipated drug costs might be. And it'll give you a 1 through 10 ranking of how good a fit Sunfire thinks that plan might be for your beneficiaries. So in this case, because of the open network, Sunfire really loves that as an advantage for your Med Advantage folks. You'll get that. You'll be able to add drugs and add doctors here as well. Were we to add specific drugs or costs, we'd be able to scroll down and look at what drugs are projected to cost, what month your beneficiaries would hit the coverage gap or the initial or exit the initial coverage stage. And you can conduct enrollments here, get your scope signed, all kinds of stuff here. Happy to show you all this tool tomorrow morning at 10 o'clock. Or whenever you want to give us a call, happy to walk you through it. All that said, Dave or Robert, anything to add about any of the tools we talked about so far before we talk about how we can get these folks some more money and vacations in their hands?
You know, I know we're bringing on some new agents. Technology is always key for our agents' success. This Coverage for One is a tool that I will stack up against anyone out there. The rating, the 10, where it rates at 9, 10, is phenomenal for you. It takes all the guesswork out of there for you. So I really encourage you to jump on that webinar tomorrow, or call your account manager or Dave and I, and or Randy, and we'll walk you through this. It's a phenomenal tool.
Yeah,
Yeah.
I would also add, thinking back to the Jarvis website, UHC's portal. As far as agent marketing materials go, you will never find a more robust offering, and they make it super easy to customize stuff with your information and order either print copies or download them. A lot of their materials are even customizable down to the point that you can pick which plans they represent on it. So, number of slides back when we were looking at the Advantage plans, and there was a screenshot of a flyer with the PPO options on it. I built that. I picked the 3 options I wanted to see on it. I could have included HMO POS options. I could have included all sorts of things there. I even got to pick the fine detail of the value added benefits. It gave me a list of like 20 options and said, pick 12 you like. And so you can customize their materials down to that level, along with all of your contact information, really make yourself look like a true UHC partner. Great for your clients, great for your marketing efforts. So something I don't see as much from other carriers. But, I think that's about all I'd add to technology. So of course, with all of that, I know you're left wondering, dollars and cents and rewards, right? Because we told you that there are some good ones out there. And I've got 2 things here specifically that I want to chat to you about. The first is an action program. We're trying to grow our footprint with agents and UHC right now. We'd love to bring on some new partners. So for folks that get appointed with UHC under action before October 1st of this year, or if you align with us, although that can be a little challenging because of blackout periods, if you're already appointed and you want to know how to make things happen, talk to me offline. I'm happy to work through the details with you. But for folks that get with us between now and October 1st, we're offering a simple $100 bonus per Medigap contract, anything sold through March 31st of 2024. So love to get you selling those supplement options. Love to get some extra cash in your hands. This is a wonderful way to do it.
Wonderful and compliant way to do it.
Yes, that's fair too. Good call, Randy. This other program that I want to call out is from UHC, and I will admit that because of the qualification window, if you're truly new to UHC, you're going to have a hard time getting there before year's end. But I wanted to include this because I think it's a fantastic benefit for agents, a nice reward, and they've done this very consistently over the years. So based on your sales production of eligible plans in any given year, you can qualify for some amazing travel rewards. And there's nothing like traveling on a carrier's dime, right? So, you look at the tiers here, Sapphire, Emerald, Diamond, those are all obtainable. I'm amazed when I talk to agents that have been selling UHC for a number of years, how many of them actually qualify for these programs and these trips. And there are just fantastic options to visit, nationally, internationally, lots of cool travel opportunities. And so if you're planning long term, and you can count on the fact that UHC is going to be here long term, that they're going to be paying member claims, and you're not going to have any issues. They're not going anywhere. Think towards next year. Think towards your sales goals and how to fit UHC into them, and you might just find yourself flying off to Napa or running off to Puerto Vallarta. And who doesn't love those options, right? I think about winters in Michigan, and both of those sound pretty good to me.
Hey, Dave, not to put you on the spot, but what is the eligibility? It says have 25 commission eligible and paid sales per calendar year. So during the AEP, they write 25, they get the one of the levels.
Yeah. You've got to have 25 to qualify for any of the UHC rewards. That's what gets you into elite agent status. And then it's based on your total book, number of qualifying sales required in any given year. But if anybody's really curious, happy to send over the full info on this and get you all the details.
Come on, you guys, 25 to get to elite. I think every single one that's on this this program today is going to be capable of that per month.
For clarity's sake, we should point out, though, that to keep the program compliant, right, this is only for med sub sales, right? So
Med
this
subs.
particular incentive, that date that we have here on the screen, is only for your med sub sales. So when you hit 25 sales per calendar year, that's when you're starting to talk about these particular incentives here. Remember that no one, not even a carrier, can pay you anything above CMS commission rates. They can't give you additional rewards for Medicare Advantage sales, right? That's governed by CMS, locked down by CMS. This, though, is built for your Medicare supplement sales and progress. See, I do see your question, by the way. We'll get to that in just a moment. We got a few more points to share with the folks.
All right. Well, and that really does about wrap it up. You know, I think we build this training as 4 great reasons you should be selling UHC if you're not already. We've got 5 on the screen here. I think we've given you lots more to think about. But
Can I give them a couple more?
Yeah, throw it out
Okay.
there.
Ayo. No, I'm just kidding. So you know, I want to get you fired up, and there's a couple, just 3 more things that I want to really hone in on. One is the dental. Why they're dental? No ID card or claims forms to fill out when obtaining services from a network provider. Super, super easy. There's 4 plans to choose from with no waiting periods at all, except for the high one, DVH 3000. That only pertains to the implants. There's a range of calendar year maximums from 500 all the way up to $3,000. So if there's somebody that really needs some dental work done, there's a plan there that's going to cover that. All the plans cover preventative at 100%. And on the highest 3 plans, all basic services are covered at 100%. Dave, you mentioned the wearables. UnitedHealthcare and Fitbit have teamed up to offer on select Fitbit devices at no cost to members on selected plans. Eligibility varies by plan, so everybody should always be checking your EOC for specific Fitbit device benefits by plan. Flex benefits. When Joe and Dynamite Guy were on the TV, they talked a lot about flex cards. That still hasn't gone away. People are still asking about flex cards. The flex benefit is a prepaid Visa debit card that can be used to enhance or extend a plan's routine dental, vision, or hearing benefits. Members receive an annual amount to spend on covered goods and services beyond their base benefits. So they can spend this on all 3, hearing, vision, and dental. It can be in-network or out-of-network. It just enhances whatever they have now. And then the last thing is their U-Card. This is a huge benefit for everybody. The U-Card can be used in 53 networks made up of 55,000 plus national, regional, and local stores, as well as select farmer markets. Some of the legacy retailers: Walmart, Kroger, Walgreens, CVS, Rite Aid, Dollar General, Publix, and then there is also one on Mom's Meals. It's a food benefit for the U-Card that could actually buy some food online. Just blows my mind that this U-Card is one of the benefits they get. And it's also the OTC card, so they can use it, as you said before, depending on the plan. You can use it for over-the-counter, for vitamins, pain relievers, healthy foods, and on the D-SNP, you're going to use this for gas, water, sewer, home internet. So they can check their balances on the app, website, or call in, shop online or in person. Just all kinds of things to get fired up about and get your clients fired up about. So I'll be quiet now. Thank you.
Well, and just to be clear, that U-Card that he's talking about is your member ID card as a UHC member. So, you know, we used to talk about Med Advantage being cool because it was one card for all your benefits, as opposed to Med Sup and a PDP and your red and white and blue card. That U-Card is one card that does all of that. It controls all your benefits. So very, very cool, really innovative. I think it was new last year, if memory serves. So good stuff. Stacy, your question about PPO providers not showing participating in the UHC PPO plans. How do you continue to get coverage if you're seeing an out-of-network provider? If you're in one of those open PPO plans, it's really a matter of just asking the doctor if they accept Medicare. If they take original Medicare, you're covered with them. They can bill UHC without any problems at all. And
Yeah,
I don't know,
and
Randy. Oh,
yeah, I was gonna
sorry.
say, and look at the non-PPO benefits as well, or the PPO HMO POS. You might be able to get that provider in there in one of those. But a lot of times the non-PPO benefits mirror the PPO benefits. Not all the time, but sometimes they do. So look at your non-PPO before you turn them away from all the other value that there's on there. We can help you look those up too.
Absolutely. Any other questions while we're all here? Oh, you're very welcome, Stacy. All right, well, we'll hang out for another minute or two, and we thank you very much for your time on this gloomy day. Hopefully, we brought you a little bit of chipper and cheerful, and hopefully the sun comes out and clears up for the day, and we can all enjoy it. But otherwise, thanks again for the time. If you're interested in getting appointed with UHC, getting aligned with action for UHC, if you have questions about anything we've covered today, feel free to reach out to us, myself, Robert, Randy, your account manager. I think it's safe to say everybody at Action's fired up about these plans and really excited to help you get out there selling with them. So always available to help.